I have new acne and dark spots. What can I do post baby to get my skin back to the way it was?
So two different problems. One's acne and one will be brown spots. And this is so post baby, so not while you're pregnant. Browns and melasma, especially after pregnancy, can be very difficult to deal with. And so I don't ever think of browns on the face as a one and done treatment. It's sort of more like you're fighting a longer term battle or war, and you have to be consistent and sometimes with multiple things. So there's some topical skincare things that we can do. In addition, there's some laser type treatments that we can do. And again, depending on your skin type and how sensitive we think your brown spots are, there's even different types of lasers that we'll use. So for example, someone who is very sensitive and prone to melasma, we would use a pico type laser, which means that we deliver the energy pulse in billionths of a second. And that really doesn't allow the tissue to heat because it hits it so fast. And that's really good for someone who has more sensitive browns or melasma after pregnancy. And with respect to acne, that's also something that we deal with. And that's also sort of a multimodal type treatment. One thing that we'll do is skincare with anti-acne type products. And then the other thing that we'll do is a laser. And I'm actually medical director of a laser company. And so I help them develop and test and do FDA approvals to bring to market new lasers. And one of the lasers that we have more recently brought to the market is called the AviClear. And so this is a laser that actually significantly reduces and or cures acne for lots of patients. And so it's a quick, about half-hour procedure where we sort of do a laser procedure on your face with you awake, and it targets the sebaceous glands and sort of dries them up so that we have a significant reduction in acne over 2 or 3 treatments. And so both of those, it's kind of a combination of things with topical and technology.